What's up, y'all? It's Dr. Mia, your B3 specialist and board certified gynecologist at Bella Wellness Center. Our focus is gynecology for women and adolescents, but we also take care of women and men for total wellness solutions, which include hormone pellet therapy, weight management, intimacy solutions, total wellness with supplements, and laser hair removal. Our goal is to help you live well, age well, and experience everlasting intimacy. So we're going to focus a little bit on gynecology today. And I'm going to talk about on the gynecology days, I'm going to talk about some of the common concerns and common problems of a lot of the women that I see at Bella Wellness Center. And one of them that I know comes up a lot is urinary tract infection. So a urinary tract infection is an infection of the urinary tract. It usually starts with the urethra and it can go up to the bladder and it can even go all the way up to the kidneys. The symptoms associated with urinary tract infections would be burning with urination, going to the bathroom more frequently, not being able to empty when you go, sometimes lower back pain, sometimes pelvic pain and cramping, sometimes fever and chills, especially if it moves up to the kidneys. So the ways that you can prevent urinary tract infections. Well, for one, if you're over 40 and your estrogen in your vaginal tissue is starting to decline, by treating the vaginal tissue, that definitely helps to prevent urinary tract infections. So treating it with an over-the-counter hyaluronic acid or a prescription vaginal estrogen or vaginal DHEA. And I recommend treating the tissue at least twice a week. For some people who have more severe dryness, they may need to do a round of 2 weeks every night and then go to twice a week at night. Whenever you use those suppositories, you're going to use them right before bedtime. So if you have intercourse that night, you're going to clean up, go to the bathroom, because you always go to the bathroom after intercourse. And then you can put that suppository in, because you don't want to put it in before intercourse because it may irritate your partner. So to prevent urinary tract infections, again, treating the vaginal tissue as you age and mature. Another way to do that is to also use the bathroom every time after you have intercourse. And if possible, have intercourse with an empty bladder. So those two things will help decrease your risk of urinary tract infections. Of course, drinking plenty of water, all of those things. But the main thing is to empty after intercourse and to treat that vaginal tissue so you're less likely to get the tears. And urinary tract infections aren't as big of a deal when you're young and you're premenopausal and you're in your 30s, 40s, 50s, and 60s. But as you get older and mature, urinary tract infections can actually put women into the hospital because it can be a more severe infection. So you want to make sure for prevention, if you have an older mom or aunt or an older woman in your life, recommend, even if their doctor doesn't ask them about vaginal dryness and treat it, you can get over-the-counter treatment aids like the hyaluronic acid over the counter, and you can have them to place that in vaginally twice a week at night. Also for the vaginal tissue, there is an oral option as well. So there's a prescription medication that you can take every single day by mouth, which actually works on the vaginal tissue. So urinary tract infections can be prevented by emptying the bladder, by treating the vaginal tissue, making sure you're drinking plenty of water, but mainly by emptying the bladder after intercourse and treating that vaginal tissue with either a hyaluronic acid that you can put in vaginally, or the vaginal estrogen, or the vaginal DHEA. And now we have the nice kind of glycerin-like suppository, so it's not as messy as the creams. That's why a lot of women did not want to use the treatment, because it's irritating to use those creams and sometimes it interrupts sleep at night. But using something on the vaginal tissue prevents urinary tract infections, and that's something that we would like to prevent because it's no fun and it can be very painful. It's Dr. Mia at Bella Wellness Center. My goal is to help you live well, age well, and experience everlasting intimacy. I will see y'all tomorrow. Remember, empty your bladder, treat the vaginal tissue, preventing urinary tract